First, to our top story today. A poor health record among British citizens is costing the country's economy billions of dollars. Well, a new report warns the cost of having most British workers poorer and sicker is around £43 billion a year. Well, the report published by the Institute for Public Policy Research says improving the UK's health is important for both the economy and the income of vulnerable groups. The think tank points at the long NHS waiting list, adding that the government should target big health improvements and work towards making the UK the healthiest country in the world within 3 decades. Well, the report also urged ministers to deal with a long-term sickness equivalent of the drive for net zero carbon emissions. Meanwhile, other data suggest the total number of days lost to sickness among the UK's workers has jumped to a record high. According to the Office for National Statistics, around 185.6 million days, are lost owing to sickness or injury. Now, this is the highest since the department started to document these numbers in 1995. The most common reason for absence in 2022 were minor illnesses, including coughs, colds, flu, and even diarrhea. Well, according to the report, poor health is to blame for more than half of the 3.3 million people who left paid employment, and almost a third of working-age UK citizens claim they have suffered from some form of long-term illness. Well, the absence, it costs the workers an average £2,200 in earnings, as several workers were forced to give up their jobs or cut back their hours. Well, in a report, it covered 7 years before and during the COVID pandemic. The think tank said that the health of the UK population is actually going backwards. Well, the UK's workforce remains smaller than before the pandemic. UK Chancellor Jeremy Hunt has taken steps to encourage more people to come back to employment. Well, to discuss this issue, joining me now here on the programme is Mark Brolin, an economist and an author as well, joining us live from London. Mark, good day to you.
Morning.
Well, not only is this an issue for people, of course, but for the British economy as well. How can this be resolved and how do we get here?
Well, I'm not sure how to resolve it yet, but the reason it has turned into a big issue is that in the 1970s, it was making up only 10% of the total budget. Now it's 20%. So it has doubled. So it's a major cost now. And in 2020, it actually overtook pensions as the largest single individual cost item. So that's one of the key reasons it's turning into such a big thing. But I think the second big point here is that it's Labour is having a lead over Conservatives. So Labour is going to trying to talk about this as much as possible ahead of the next election, whereas Conservatives are probably trying to shy away from this debate. So I think, if we go back to the reasons, I don't think we have any proper good reasons why the UK is doing poorly now. We know that this has lots to do with mental issues and stress-related issues. But why UK is doing worse, I don't think we have a good answer to that.
Okay, so what do we do in this situation? Because it is a vicious spiral at the moment, because obviously we need people in work, earning money, and also paying into the tax system. Otherwise, the British economy is going to suffer as a consequence. Do you think that COVID is to blame for much of this, given that we have huge, enormous waiting lists, some 7 million people here in the UK still waiting for minor operations such as hip replacements or work on their knee? I mentioned there even coughs and colds are causing these problems. Do you think maybe we've got a situation now where people just need to go back to work, even if that is partially or part-time, some sort of situation where even if they do have a condition, they need to work part of the time? Could that be a solution, Mark?
I'm sure you're onto something here. COVID is definitely part of this story, since it has changed work patterns in a big way. So possibly a sort of work discipline factor, that of course that's a major issue. But in a sense, also, I think we have to accept that the cost item will be a lot higher over time since we live a lot longer. There's many factors in play here, but definitely COVID is one of them.
Yeah, I think you've made a really good point there about living longer. Of course, people are going to have more ailments the older we get, and also the retirement age as well is maybe creeping higher too. Mark, thank you so much indeed for giving us your input. We really appreciate that. That's Mark Rowland there, an economist and author here on WION Today.
Thank you.